Greetings, greetings, greetings. Hello, everybody. Again, welcome back to Let's Discussions of Life, Love, Wellness, all of that. Today's Let's Talk, we're going to talk about childbirth, African American family. And if you're not even trying to get pregnant or anything, share it with somebody. For all of those that are listening or looking, share it with others, inform others that you know that are in the process of wanting to have kids or making decisions on how they want their childbirth process to go. And hopefully they can gain some insight for that. And we're going to have discussions around the pregnancy and childbirth, particularly in the African American community, even though a lot of things we discuss applies to all cultures. But we're just going to kind of address some of the concerns and issues that we're having in our own communities and seeing the different modalities and everything. So I'm excited for all that are joining, and I just say share with everybody, let them know to come in and join us at any point in time during the dialogue or discussion, and hopefully they can get some great insight. So I'm excited to bring on my guest today and talking about this journey. And it was very beneficial for me. Like I said, for many who don't know my story, even with childbirth and pregnancy, it wasn't until I was 40 that I had my first child. And so still trying to process that in the present, having a child at that time. But if it was not for the help and assistance of my birth team, I had a doula that was there to assist me, and we will talk more exactly what is a doula. I know people say they've heard the terminology, but what is a doula? They really assisted me with that process, and my whole experience between having an energy worker there, a licensed body massage therapist during my pregnancy, all of those helping me to assist me with the mental aspect of childbirth, the emotional, the physical, and all that was so beneficial in my pregnancy. And I think it's very key to us having healthy pregnancies. And I think it also may have a lot to do possibly with the occurrences of the deal with during pregnancy, depending on how the actual pregnancy, the emotional state of being during the pregnancy. So I'm going to bring on my guest today. We're going to welcome Miss Stephanie, Dr. Devane Johnson, and Iman to the show. I thank you, ladies, for being here. How are you guys doing?
I'm great.
How are you? Thank you for the invitation.
Yes.
Thank you for being here. All is well on this day. Always a good day to provide education and wellness to others. Just in general, I've given a brief bio on the group about what you guys do and what you guys offer. But Stephanie, if you can just, and y'all have to say I'm so excited about today. Stephanie is a classmate of mine, 49 and proud of UNC Charlotte. We've been friends freshman year, so it's always just wonderful, from those days of being 18 and young to what we actually grow up to be in life. I just remember Stephanie, those times when I'm out partying, Stephanie will be in the room studying and talking junk about us. She got work to do. So it's all paid off that we now have the Stephanie Devane Johnson here to share her career and the impact that she's making in childbirth and pregnancy and all the studies that she's doing. So if you can just give us a brief overview about your works, Stephanie.
Of course. So like you said, I am a certified nurse midwife. I obtained my nursing degree from UNC Charlotte in 1993, showing my age, our age. And I obtained my master's degree in certification in nurse midwifery from Vanderbilt University in 97, and my doctorate of philosophy in nursing from UNC Chapel Hill in 2016. So I have been actively practicing nurse midwifery for 22 years. And now I am an associate professor of nurse midwifery at Vanderbilt University. So I'm teaching the new generation of nurse midwives, having delivered over 2,000 babies, doing well woman GYN, antepartum care as far as pregnancy care and delivery. I transitioned into education and doing academia. But I have a passion for my all mamas and babies, but more specifically my African American mamas and babies, with the disparity that's going on now with the maternal child mortality rates and everything that's going on in the nation and worldwide today.
Thank you. You are needed. Miss Iman, share with the world who you are.
Hello, everyone. Asha, thank you for having me to this beautiful session. But for everybody, my name is Iman Boykin. I am the owner of Sacred Beginnings LLC, and I am what I like to call a holistic doula. And why I call myself that is because for me, it's just not about the birth experience, but it's about healing the family. Because we find that a lot of times the trauma that we endure childhood as we go through life, it affects the woman, which affects her womb, which now affects the child when the child is born. And then oftentimes we wonder why children have issues. And a lot of times it stems from the energy that they were receiving while in the womb space of the woman. So I like to focus on whole health. So most of my clients, I work with them during pregnancy, during birth, and then after. So the relationship that is built is just amazing and absolutely beautiful. I'm always honored to be a part of the sacred birth experience. You know, a lot of times people ask me to describe what it feels like, and there's no words to describe being part of seeing a spirit come into this earthly realm. It is just absolutely beautiful. So I have a passion for it. I've always had a passion for birth. From being a young child, as early as 3 years old, I said I was going to be a baby doctor. And then as time went on, as I started getting into going to actual classes, I realized I don't really like the business of birth. I wanted to work with women on a more sacred experience. And so that's when I began to look into being a doula. And that's where I am today. And I'm honored. I love what I do. So thank you.
Great. Thank you. While we're here, I'm going to bring on another sister into the live stream. I'm going to bring on Latifa, who just had a beautiful baby girl, and she actually used a midwife in her birthing process. So I thought that would be beautiful for others to hear her journey on what that was like as well. And just general starting out, do you feel, I mean, when we talk about childbirth and pregnancy in the African American community, what is it that research is really showing that we're dealing with? I know we talked about the whole thing about breastfeeding and why in the African American community we are resistant to actually breastfeeding. And I know we talk about a lot of the taboos of our disconnect with our bodies and the shame aspect. But how do you see that impacting the birthing process from what research that you've done?
That's a great question. Well, with the statistics that are out now, Black women, women of color, die either during childbirth or after childbirth 3 to 4 times more so than our white counterparts. And this is even being seen when all other things are equal, whether it be socioeconomic status, education, and everything like that. Black African American women, Black women are dying more often. So there's a lot that's going into, a lot of research that's going into why. What is this all about? And I think it's a lot we're not listening to. A lot of our complaints, some of the things that we go back with are kind of falling on deaf ears. And it's up to healthcare professionals to listen to women. We know what's going on with our body. We know when something isn't right. And having a doula would go in with patients as their voice and helping them navigate. Sometimes it's hard to navigate the healthcare system. Sometimes people talk above where people are, and you have to kind of meet individuals where they are. So if you don't understand the language, you're not going to know when to push back or when to ask certain questions. So I love when my patients have doulars that can help them navigate if they need it, or just help them be a sounding board. Whenever, because I have a short, limited amount of time with patients in prenatal visits, but the doulas are there from, can have longer visits at home, labor patients at home, and then they come to the hospital when they're more in active labor. So I just believe in that healthcare providers need to make a conscious effort to listen to Black women and what we say is going on with our bodies.
Mm-hmm. Right. And why do you think, or what have you seen in your research, the whole breastfeeding? Does that have a lot to do with the aftercare? What
support? In the research that I did qualitative research where I interviewed African American women from different generational, from 18 to 29, 30 to 50, and over 51. And a lot of it is, a lot of Black people don't see other Black women breastfeeding. They thought it was a white thing. And it also starts, what happened in our history does have consequences to present day healthcare behaviors. So the wet nursing, where the enslaved African was forced to breastfeed her captured children, that is still not as salient as some people might think. A lot of people like that happened 300-400 years ago. That can't be influencing present day behaviors. Well, it does. These pictures are on social media. And when other Black women, African American women see that, they don't want to be associated with it. So they go the exact opposite. And it's about taking ownership and being like, my ancestors were forced to do that. I don't have to do that now. I can afford to bottle feed or formula feed. And at that time, when formula was being invented, if you were poor, you breastfed. If you had money, you formula fed. So then a status symbol started being associated with formula versus breast. But the pendulum has swung, and white women and Hispanic women breastfeed at higher rates, but African American women are still do not breastfeed at the rates of our counterparts.
Wow, that's interesting. That's deep. I just know I wanted to breastfeed to help burn calories to lose weight. That was, if nothing else, that was my primary reason. I was like, "You sure you don't want to breastfeed?" Yeah, I see her. He weaned himself off, so I didn't have to worry about that too much. But I think that's what I guess that's probably why he still stay in my bed or sleep with me, because he was breastfed, baby. But but all of that, that bonding, and I think that's another beautiful thing with breastfeeding, the actual bonding with the child that you have when you breastfeed. Iman, what have you seen in being at a doula that I know we live in highly stressful times. Most of our issues, health issues and stuff, come from a highly stressful that you're having to provide the most amount of support.
You broke up a little bit, Asha, so I didn't hear the end of the question.
I don't know, she froze.
Can you hear me?
She froze. Okay. Well, she'll freeze. She'll come back in. So Latifah, since you have just had your experience with childbirth, what was it? Okay. Are you back, Iman? Can you hear me?
Yeah, I can hear you. Can you hear me?
It's still static.
It's a
Look, I'm gonna put some Reiki on your camera and the internet.
Can you hear me now? Asha's gone now.
Oh, she's going now.
Can you guys hear me?
I can hear you.
I can hear you.
Okay. Hi, Tifa.
Hi, we're gonna see how long this one hold out.
We back.
Can you hear me now?
I can hear you now. We back in action. We had to reset, reboot.
Okay, cool. So What was the end of the question? Because you broke up and I didn't hear it.
Question, as in being a doula, where do you feel your support is most needed in supporting the African American family through this birthing process?
Oh my God, education. A lot of the things that you see that happen, like what Stephanie is talking about when it comes to the higher rate of death, is just a lack of education. So if you're not educated and then you go into these birth settings, i.e. the hospital, and they throw all this information at you. You got to sign this paper. Are you going to do this? All this information is coming. And then you have to think of also this woman is in labor and is getting ready to experience the birth of a child. So if they don't have the education, they're ignorant. So now they're ignorant, which is a domino effect to other things happening. So education, being an advocate for them. A lot of times, again, they're in the mode of birth. So they may forget certain things, or they get so caught up in the emotion they want to end up doing plan because of the pain. So just reminding them of their power. You're basically there to empower them and let them know that everything they need, they have within. They don't have to pull from anywhere. We are women. We have everything we need within. So just being that reminder to them is important. So education, advocacy, and just empowering them and making sure they understand who they are, what they are, and what they're doing, which is birthing a beautiful spirit. So just reminding them, of those things throughout the process.
Yeah. And I think that is so key. And that's why I was so thankful for my doula. Like I had a lot of, I'm not going to say fear, concerns of being a mother, having, a late pregnancy at 40. And I felt I needed a lot of emotional support with me during that process, just to keep me grounded with reality that I'm about to become a mom. But yes, especially with wanting a more holistic approach in our system, sometimes it's like they felt irritated that in the hospital that you're wanting approach, and it puts that pressure, because I know if it was not for my doula being there, my labor was 27 hours. Wow. And from after 8 hours, when I had not dilated, that is when they were wanting to induce me and possibly do a C-section. But I was totally against it. So I was thankful to have my doula there to assist me with that process of advocating for me. Because I know if she wasn't, I would have been so tired of fighting the contractions that I would have said, forget it, just take the baby. But with that and her providing energy work at that time as well, really helped that whole process to keep grounded, that it didn't become emotional decisions. And I think sometimes in that medical environment, it's the pressure, because they talk this lingo and this jargon, and you feel like they must know what they're talking. I'm not saying they don't know, but it goes back to that self-knowledge and connecting with self on what is right for you. And then when you make decisions during a pregnancy that is not in accordance with your spirit, to me, that is when some of the complications or some of the issues after the fact can actually take place. Latifa.
Hi.
I see that beautiful baby there. Tell us, what made you decide to choose a midwife for your pregnancy, and what was that experience like?
Basically, I didn't want to go into the healthcare system, especially knowing that, like Stephanie said, that, African American women have a higher death rate than, other ethnicities. I was like, okay, I really didn't want to go to the hospital. I didn't want to have to go through that whole process of having to fight them about certain things that I knew that I wanted, especially leaving the placenta intact, not cutting the cord. Just I wanted to actually experience how our ancestors used to do it, instead of, being westernized, having to lay in that position with the stirrups, and, that not being the natural birthing posture, for having your children. And, just I was actually happy that I am, at a higher age, and I was able to know all of this stuff before I actually had a child. because then I would have been forced like everybody else to go to the hospital. And I didn't want that. I didn't want to have to go through that whole process of, just having to fight for your own right of how you want to actually work it out and not be, a statistic inducing, just so that they can rotate the beds and get people in and out. And like, you can't tell me my baby's due date. My baby's date is the date that it comes. Sometimes you guys guess and it's right. It just happens. Like, the due date is when it's coming through. Like, that's what it is. You can't, predict that. So I wanted to, not have to worry about that, arguing with anybody, just because I already know how the system is set up. So, it made me want to find a midwife. And it's interesting because I didn't have anybody. I didn't have no reference points, and you don't want to just pick up anybody off the internet or, just like I'm some random person like you don't really have a connection to. So I wound up speaking to one of my friends, and they recommended their midwife that birthed their 2 children. So I was really excited about that. The universe really put that together for me, especially with that being such a huge decision. And after that, it was pretty much, cake after that. I just knew that I wasn't going to the hospital. I didn't have to worry about any of that. And I was happy. So, the process came, and, I powered through, and it was, I definitely didn't want to have to, worry about an epidural. And I think if I was in a hospital, I would have asked for an epidural. Like, it's, like, once you at home, that you already chosen that you don't want to do any drugs. You want your child to be alert when it comes in and really connected, you got to really deal with that decision when you're at home. But when you're in the hospital, because at the end of the hour, I was like, look, let's go to the hospital. We're going to cesarean. Let's go. We're going to cut it epidural.
Right.
Like, yeah.
Right.
So it actually made it, even more just kind of a surreal experience, just because, you really just have to go within and understand, just like Iman said, that we already have everything within us. It's ancestral. We already have, the knowledge of what we need to do within our own bodies. So it was an amazing experience. I recommend it, and it really shows you your strength and your power, because you really just go through naturally, and whatever happens. My child had her cord wrapped around her neck twice. So imagine that. People, they tell you when you're in the hospital, oh, the cord's around the neck, we got to do a cesarean. Oh, I don't want the kid to die. Like, that's not going to choke your child. It's, they've been in there all that time and it didn't do anything. Like, you just got to know that, everything is going to work out, and that you have this as a process.
Right.
So it's awesome.
Right. Beautiful. Dr. Johnson, Tiffany had mentioned something like, if someone wanted a midwife, where would we start? Is there a resource system? Is there even an African American midwife listing for people if they were looking specifically for African American women? Where would they go to get this information?
Well, first off, depending on where they live, you could always just start out with Google and just Google, are there certified nurse midwives in my area? But our governing body, ACNM, American College of Nurse Midwifery, they do keep a running tab of all the nurse midwives in each state. And I do know that there is a Black midwifery, kind of not necessarily a listserv, but there's somewhere it's a list of all the African American midwives I can only speak to North Carolina, in the North Carolina area, because I've had some families reach out to me before I retired from delivering babies in 2014, and it was just like, oh, I saw you on the list. Can I have your information? I was like, I'm not delivering babies anymore. But there is a way, because there are quite a number of African American midwives in the state of North Carolina. Not any that I know of that are doing home birth, but I know one, Tina. She is doing home birth in the Raleigh-Durham area. And the others are associated with a healthcare facility.
Okay. And backing up, Dr. Johnson, tell us a little bit, what is the what is it that a midwife can do, doctor, or compare to a doula? I know there's a lot of laws that govern you. What is it that your role is allowed to do and what a doula is able to do?
So from the nurse midwifery angle, can do everything that a physician would do except surgery. So I'm trained in the normal to detect the abnormal. So I am kind of a watchful eye to secure the well-being of mom and baby, both physically and emotionally. And the doula plays into that, and we're really a really good team. Sometimes when I was at the hospital, I would have 4 or 5 individuals in labor, and I couldn't be able to stay from beginning to end with a person. And with somebody who has a doula, they're with them. Their doula is their doula. They don't have to share. They are with them from beginning to end. Whereas I might have to pop in and out depending on what I have going on. But if I only have one patient in labor, then I can stay from beginning to end. But it's so unpredictable that I advise patients and strongly encourage them find a doula, interview 2 or 3, find somebody that you all have the same common goals and your personalities mesh, and contract with them. That way, you know you have your person. Granted, at the hospital they'll have a midwife and a nurse, but again, competing demands, and if we're busy, we can't obligate and be in there the whole time. Unlike the doula, who can be there for that emotional support.
Gotcha. Wonderful, wonderful. I know another thing, and we're talking about the holistic approach that assisted me in my child with me understanding energy work and being a Reiki practitioner. It's something that it was very vital with me having tools of the whole energy work and the laying of hands or the energy work. Even from when I started having labor and went to the hospital, I was doing energy work on myself the whole time. And I also was trained to do ear acupuncture, which helps with pain. So I needled myself up as soon as I started having contractions. So when I got to the hospital, they were looking at me like, you know, of course, they want to send you back home if they don't think you're in labor, until they hooked me up and they looked at the machines and they looked at me and they were like, "You're in labor." And I'm like, "Duh." But I was like, "No, your levels are high, but you're not acting anyway." And I'm like, "I'm just doing energy work on myself. I don't, you know, all I know is obviously it was working, because they were looking at me in shock, like, no, you know, we're about to deliver soon, but you're too calm." One of the things with Iman, well, both Iman and Latifa are 2 of my students are Reiki practitioners. But the beauty, when we talk about the support of childbirth, one thing I have to say, since we're talking about African American families, and even as a mental health professional, is understanding sometimes the genetic trauma or epigenetics of things that passed on generational to generational through our families. And even the whole childbirth, a lot of times with some of my clients, I have them have to go back to their birthing process or ask what their birthing story is. And many people really don't understand, what does that have to do with me as a grown person and how I'm dealing with life. But having an understanding of what that birth was like. Was it traumatic? What was your mother going through? We all want to think that our birth was just so happy, or the whole pregnancy was just the happiest thing on the world, but we don't know if our mother was dealing with emotional issues, financial issues that all play into the childbirth. But one of the beautiful things, even with the mind being a doula and a Reiki practitioner, that we don't realize, doing energy work on a pregnant mother is going to help heal past family trauma. So it's one of those things we don't realize, how sometimes genetic, we don't even realize that we are passing on faulty belief systems and the generational traumas in our family. But to be able to have a form of energy work throughout that whole pregnancy is helping to shift the wound, is helping to shift that space that we're created in, to provide a more healthier and balanced state, not only for the child, but also for
Did she freeze for you guys?
Yeah.
Yeah. She'll be back. Send her a message.
Iman, how did you go about your doula training?
I went through Kappa. They're an organization that train doulas all over the United States and I think out of the country as well. So I went through their training, and then they had a certification process, different books she had to read, and I had to attend a certain amount of births and get that, and then they, give you the certification.
You back, Aisha?
Cool. I'm back home, and I was just talking. I was on a roll. I was going on and on. But, I don't know what y'all were talking about, but I'm glad y'all kept talking. But in that process, I think I was asking, talking about the importance of the community work and Iman and what you're seeing. When you're working with families, do you ever go back and ask them about their parents' birthing process to have an idea of how the present pregnancy may be?
That is part of my interview process. I want to know what their relationship is like with their parents. And it's, for me, it's funny, but I find there's a lot more issues with the mother-daughter relationship in a lot of my pregnant women. So that is a part of the work that I do with them throughout the time that I'm working with them, for them to address that. Because if they don't address that now they're passing on all those emotions and feelings and pain onto this baby. So yeah, that's part of the questions that I asked from the beginning. Because again, I want this woman to be as whole as possible. So it's not just about the things that you're going to look at when you go to the doctor, how many weeks you are, how much does the baby weigh, is the head down, and all the different tests that they do. That's great. But what about, where is this woman spiritually, mentally, emotionally? That's something that I address throughout the process of working with them. And what sparked it for me is talking to one of my friends, and kind of what you're saying, Asha, about just the whole thing of passing things on and the trauma and understanding your birth story. So she didn't understand why throughout her whole life she felt unwanted. But once she figured, went and found out about her birth story, she realized that her mother never wanted her. Her mother went back and forth about getting an abortion and was never attached to her while she was in the womb. So of course, when you're born, you haven't felt wanted the whole time you're in the womb. And so throughout life, you're still going to feel unwanted, which then turns into other issues, acceptance of abuse, and just a lot of other things. So the birth story and understanding the mindset of where your mom was when you were in the womb is so important. So important. So yeah, I definitely address that.
Oh, and that's so key. We don't realize that, going back to that holistic approach of the mind, body, and spirit, and addressing that and making sure we deal with that. There is a question in the group. Let's see. Iman. Oh, wrong one. Sorry.
I see it. How long
where is it? Oh, here we go.
So
yes, how long is a doula certification?
So it depends on the organization that you go through and what their requirements are. Mine, they gave you, once you went through the actual training, you had 3 years to complete all of the requirements. So it kind of depends on how quickly you went through those requirements to actually get the certification. But it's different. And honestly, everybody doesn't go the certification and training approach. Some people just understand, this is my calling, this is my work. And they study it on a whole different, approach than going through the traditional classroom. So even for me, I went through the traditional approach of going through the organization and getting the training and going through the certification process, but I applied my own touch to it because it's me. So I do things differently than what I may have learned in my doula certification, because I have to make sure that it's me. And when I go into those spaces, I'm being me. and people will, what's for me is for me. So I think it just depends on the organization and how you decide that you're going to become a doula, because there's no right or wrong answer, honestly. It's just that you truly have to have a passion for it. And if you got the passion, you can do it. So.
Right. The other thing I wanted to ask and talk about, and Dr. Johnson, you may be able to assist me. Is it a thing of diet? Is it more emotional? How do we address the postpartum? I'm seeing and hearing about more women dealing with postpartum depression, and even in my the clinical aspect. And sometimes as a clinician, I'm dealing with the mental health side of processing with depression, but I know it's more genetic, and I'm not sure if it's coming from nutrition. Is it coming from past traumas? What do you see, or what has research shown about some of the causes of postpartum depression?
It's multi-layered. Especially if women come into delivering already having anxiety or depression, then they're more likely to have it postpartum. But then there's a shift in hormones. There's a lot of us who are separated from family and do not have the support that they might need to help with the sleep deprivation. That's one thing that you cannot prepare for when you have a baby is sleep deprivation. And that just in itself, on top of breastfeeding, on top of your bleeding, on top of the pain, on top of everything, can cause some women to spiral into a deep, dark hole that they can't get out of. So definitely support, having somebody there that can hold the baby. And look, just go take a nap. And that's what I always tell my friends when they have a baby. I'm coming to hold the baby. You go do you. You take a nap or take a shower or whatever. I just want to hold the baby because I'm a baby person. But those are just little things that people can do. Yes, meals are great. Yes, onesies are great. But somebody being there when we always tell women to go out, and it takes a village to raise a child. Well, it takes a village to kind of get you through any aspect in your life. And some women don't have a village. They move from one state to another and they're transplant. And so I think it would be a great thing, something that they do here in Nashville with a birth collective, is congregating the village and taking it to the mother. Having the birth doula, having a postpartum doula, having a breastfeeding doula, having other resources out there to help women adjust to being a new parent and to being a mother. And it's not all kicks and giggles. Everybody's like, oh, you have a baby. It's wonderful. Ha, 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 ha. I wanted to slit my
No.
I wanted to slit my throat. And I was a midwife. I had a significant other. I had my mama in town. But it was just like, this was more than what I bargained for. And until you live that and go through that, you don't realize that you're in a depressive state until most, especially Black women, once we put our cape on and we super women, until you're out of it. And reaching out for help in the mental health aspect as a stigma in itself. We're supposed to reach out. We are Black women. We, put your big girl panties on, suck it up, and do what you do. But it's really hard, and other things such as our health start suffering whenever we start suppressing mental health issues, not reaching out, not going to get the help that they might need, whether it be therapy or medication or anything like that. And that's what I've seen in my practice. It's just that a lot of women are leery to take ownership, to take hold to that postpartum depression, afraid of the stigma, afraid it's going to follow them for the rest of their lives.
And it's so important. And like you said, it's so deep what you were saying, because many don't realize they're in it until they're in the dark hole of it. And not knowing how to bring themselves out of it can be a very, very scary thing. Or even those during pregnancy. I think on one of my podcasts, there was one sister that was talking about even during the pregnancy, she hated the pregnancy. She did not want to be pregnant. And then we think about child once it's been born, based upon like what you said, a mom, when the mother is not really accepting of the birth, we feel it in the womb. We understand it, and when the child comes out, so even as a mental health therapist, when I do work with clients and I have them go back to their earliest memories and their childbirthing process, because I'm like, if you felt anxiety around 5 and 6 in school age, when that's supposed to be a carefree time of life, but you're dealing with anxiety, sometimes I say, it ain't your ish. That may be your mama's stuff that has been transferred to you, because there should be no reason you're feeling that. And so sometimes that helps people to identify what's really theirs, what is part of that generational. And so in explaining that, a lot of people, when I say when you heal yourself, you may also be healing for the past generation. And often we want to put that fault on the parents. Or if you would have done this or you didn't want to do that. No, the parents were just vessels. And being a parent, understanding we're just vessels to bring a life into the world. That is our sole responsibility. And once that child comes into the world, we are supposed to nurture, protect it, to groom them to be who they are. But sometimes our unresolved stuff can impact their development. And so I just think this is so important as a community, not only like we're talking about with how we birthed our children, but even releasing the ego or our superwoman cape to say we got this, we can handle this, and not let others know when we need help. You don't have to suffer by yourself at this point in time. Latifah, what would you say being a new mom? Because even we're talking about physical changes now, emotional and mental. I just, like I said, I just know what it was like for me at 40, having, and you're having a child later on in birth. What would you say has been your most significant emotional adjustment now with your pregnancy, now being a mom?
Probably just really tapping into more patience, because there's a lack of understanding as a new mom, or as a mom in general, especially when you don't have the tools to be able to communicate with the child. So you really getting through that part, and that probably has a lot to do with the postpartum that a lot of women feel as well, because you have this baby that's gonna cry. You deal with the basic needs, and changing the diaper, feeding. But what if your child is still cranky? Dealing with teasing, and not knowing what that is, and you just it's so many aspects to it that that you really tapping into that patience. And my mom has been pretty good with that, because she'll just come in with some little pep talk words and just be like, it's gonna get easier. Just be patient, and just keep working, but you're doing great. Having encouragement and somebody to let you know that you're not alone, because nobody knew what they were supposed to be doing. Through 1,000 births, you can start to visualize whatever patterns a lot of babies are going through, so you can identify what's being done through this process. But if you don't have anybody there, then just like you guys said, it's gonna take a toll on the new mother, because this one, she's very attached, and she doesn't really like anybody to not hold her. So I'm glad that I got this sling. This was actually gifted to me. I was like, it was the universe just keep sending exactly what I need, because this sling has been such a lifesaver. Because I'm like, I'm a hostage. I'm like, even being a hostage, getting caught up in that feeling, because then it's you're kind of angry that you can't get up and move and eat and take a shower, like Stephanie was saying. And it's like, okay, well, what am I supposed to do? Am I just supposed to sit here until this kid grows to a certain age?
Right.
Then it's a lot that you're dealing with mentally. So I definitely think just the patience, and just knowing that everything is going to progress. So not getting caught up in that feeling and hanging on to it. So that's actually something that I'm happy that I learned before I got pregnant and was able to have a baby, because your level of where you are developmentally also plays a part in your child experience, and that mothering experience. Because if you're not grounded, and you're not you don't understand how to work through your anxiety, or depression, or whatever your emotions are, then it becomes a strain as well. So all of that has to be taken into consideration and factored in. So I was very, I would say, grounded. This being my first pregnancy, and turning 38, and I'm like, oh my gosh, like you don't expect it. Like Asha said, like late pregnancy, you're like, what the
Mhm.
heck? I don't gave up. I was
Right.
gonna adopt. I was gonna give some little kid a happy,
Right.
but the universe has planned whatever it's supposed to have planned for you, and it was amazing, and I'm just happy I am where I am now to be able to handle all of this, because I think as a younger
Right.
mother, it's a lot,
It's a lot. Right. And you're right. And the whole thing, I think, within our community that we sometimes miss, we live in a society now where we come from a community that is community based and how we live and how we operate. But we have come across in this more Americanized Western approach to um, society, and we're scattered. So where we once may have grown up with grandma down the street, our aunts 2 streets over, and it was that community support. We don't have that now, and I just was so thankful just from my tribe and community of being a late mom and having friends and coming by and giving me support. And I just had one, and I was ready to be on the floor sometime and have a temper tantrum and say, I am not cut out for this. So hats off to those that have 2, 3, 4, back to back, because I'm like, I would be sitting in the corner for real. Y'all may have had to commit me in that process. But, I think that's where we're missing that community support with birth, individualizing everything and lacking that support, that emotional support has a lot to do with our overall health and well-being. And with that being said, Iman and Latifa are doing some big time things with supporting moms and some new ideas that are coming up, and I'm excited about you guys' collaboration. Tell them a little bit about Iman, tell them a little bit with her pause. Latifa, because you came onto the latter part, tell them a little bit about the work that you do. I introduce you as a mother, but of course, when we become mothers, we are not known as anything else except mothers. But tell us who you are and the work that you do in the community as well.
Well, so I am currently a Reiki practitioner. I went up to Reiki Master, so I also teach people who would like to learn about Reiki on all 3 levels. Um, and I've graduated a few classes. So excited, that people are interested in, learning about this stuff. And I do a lot of my sessions distance. So if anybody needs any Reiki work done distance sessions, those are kind of like my expertise in a sense. It's pretty good because now with this social distancing and us not being able to do work for people, and especially with the emotions that are coming with this whole process of quarantine and staying inside, a lot of the times people don't really understand how to balance that emotion out, and they just feel a lot better once they get it done. So I do classes where I teach people about, the chakras and our organs that are associated with them, and how our body kind of lets us know what's going on with us. So the things that I learn, I just like to be able to share them with other people, because like Iman said, the lack of education about these different things is
Teach
what,
it back.
why we have so many issues. Even with me not going to the hospital, like at all, really. I went to a, real OBGYN maybe 3 times during my whole entire pregnancy. And I actually started with my midwife before I actually went into the, GYN setting to, just get blood work done and, just to appease the father, because I was comfortable with not doing any of that stuff, and just knowing that eating properly and, maintaining, my energy, doing my exercises, working on breathing, my child was going to be all right, no matter all those tests and stuff that they give you inside of those places, that then you over there stressing about that with with the damn test that they giving you, trying to figure out what's going to happen with your baby, instead of trusting and knowing that your child
Right.
going to be safe and secure, and it's going to come out the way that it's supposed to come out. People put that anxiety within their children, just like Imam was saying, and that is what damages the child a lot of times. The nervous system issues, and
Right. Fear and
wrong
anxiety.
with the child are because of you. actually. And if you would just relax and, allow the
Right.
process to, happen and, be conscious of what you're eating, what you're feeding yourself.
It would be a better
Yeah,
process.
it's a better process. So, I'm just here to share whatever I know, just to assist with, the people who are having children. I'm actually happy that I'm able to do this now, because that was something that was like a disconnect, because a lot of my friends already have children. So, not to be able to kind of participate in that. But now it's exciting because,
You're not the oddball now.
yeah, I know, right?
Yeah, that's how I used to go with my friends from college. We used to always come together and meet for dinner, and everybody's talking about their kids, and I'm at the other end of the table, like I can't really, I don't have those issues. So now I feel part I'm inclusive in the conversation, even though everybody else kids about to graduate from high school now, and I'm just starting, but I'm part of the club. Iman, tell us what you have going on with your support groups.
So I get different ideas, and a lot of times get confirmation from people on things that have been coming to me. So what I've been doing is it was focused more on where we are right now with all this COVID-19, all the stuff that's going on right now, just understanding and thinking about, wow, how would I feel right now if I was pregnant? Or if I recently had a child, how would I feel right now? So, and then when I started thinking about that, I was like, okay, let me create just a circle and just talk, no judgment, a safe space to have a zone to ask questions, to cry, to vent, and so that is how I created this support circle. And part of the support circle, we do a meditation together. But it's very informal. So I kind of go with what people are feeling a lot of times. And bringing Latifah in, again, we got confirmation from someone else as well, someone that we both love tremendously. But just combining where she is with what I'm doing. Latifah and I, when we met, we connected immediately. So just having a conversation on our passion, what we do with being Reiki practitioners, and now combining it with life and understanding that, women need the support, and, just wanting to be able to share and just love on women. It's another, realm of sisterhood, birth and the questions and health and mental and emotional and the healing and the trauma and the pain. It's just so much that we all, want to have that safe space to be able to talk and to be able to bounce ideas off of each other and just support each other. So me and Latifah are going to be working together to, blossom and bring that into fruition. Our first little session, I guess, is going to be this Wednesday. And it's been very small and intimate, and I like it that way, because again, sometimes when it becomes too big, people don't share, because now it's like, right. Oh, I don't want to say anything, stupid or that, and that hasn't been the case. Everybody has been willing to share and just be open about where they are and what's going on with them. So I am so excited. I don't know if y'all can tell, but I am so.
You have a website. How do people get in contact with you to find out about it?
Yeah. I have a website. It's www.sacred-beginnings.com. That's my website. And then as far as the weekly and what me and Latifah are going to be doing, that's going to be on our social media profiles. We'll be sharing and putting the information out there. So yeah, excited just to love on women and love on families. And this is the way that we can, do our part to heal our communities, because our communities are hurting. And the women are, as we know, we carry a lot on our shoulders. We are the foundation. And so we need healing, and we need those healing spaces to be comfortable to heal and help each other. And just excited to be able to be part of it and have a passion for it. So it feels amazing. So.
Yeah. Thank you. Well, I don't know. I just know the love I get from you as a friend. So I can only imagine having you as far as something that's special in the birthing process. So, I highly recommend both of these ladies. And Dr. Johnson, what are you doing? Is there anything coming up that you're doing? I see that you're at a conference or presenting or something coming up soon, or did I see that?
Well, sure. As soon as COVID's over, I had a lot of presentations
Right, exactly.
that are now turning into virtual. I just did a webinar last week because it was Black Maternal Health Week last week. And so my big thing, and I think where I stand right now, I am faculty at Vanderbilt University, which is the #1 nurse midwifery school in the country.
Wow.
And I've only been there a short time since August, but I feel as though I am there to increase the number of midwives of color in the community that look like the community that we serve. And I am very passionate about increasing that number, not just at Vanderbilt, but at all midwifery schools, and just letting birth workers who feel as though midwifery is not attainable. It is. It is definitely attainable. And wanting to be there as a mentor, as a sounding board, okay, well, I'm going to do this. What do I need to do next? Kind of connecting the dots and getting them to the appropriate midwifery school. It might not be Vanderbilt, but then again, it might. But there's East Carolina, there's Frontier, there's Yale, there's different midwifery schools in the country. But I just want to see the pendulum swing and more midwives of color out in the community to help our community have safe, healthy, respectful birth.
Absolutely.
And real quick to clarify, with your requirements, you went through nursing school and then went through advanced.
Right. So I went to nursing.
What is the education component to be a midwife?
Well, there are different categories of midwives. So I am a certified nurse midwife. So yes, I went to nursing school first, then obtained my master's degree in certification in midwifery. There are certified professional midwives who are not nurses by training, but they do get formal education, and they do an apprenticeship with other midwives in the community. So each state has different ways of utilizing midwives, professional midwives, certified nurse midwives, and it depends on whichever state that you're in.
Gotcha. Okay. Well, I thank you all. I ask those listeners, if you want more information, if there's certain topics that you even want to present on, please hit me up. You can go to my website. There's a contact list there, or just to see what other kind of service about Reiki. I do online Reiki practitioner training classes. Next week is going to be good. Next week, we're going to talk about how to stay guarded and protected during COVID from a mental, a spiritual, and a physical aspect. So I myself, along with my dear friend and spiritual mentor, Kelly McCrae, and Dr. Msu Bayel, who is a Chinese medical doctor, we are all going to discuss about how to deal with this, how to protect ourselves, keep ourselves grounded and spiritually covered and healthy through the mind, body, and spirit perspective or approach. So just stay tuned every Monday at this time. I thank all of you ladies for being a part. It was great connecting with you guys and courses. And let me make sure to see if I don't have any comments on anything. Okay, that was Kelly saying this was amazing. Hey, Kelly. So from here, we're going to sign off.
Thank you again.
Love you all. Appreciate all that
you're doing. Thank you.
Thank you, Ashley.
Nice to meet you. Congratulations.
Namaste, and I thank you for being a part of it. Bye-bye.
Bye.